decrypting vet jargon.
Okay, Jim, can you tell me what a luxating patella is?
Okay, I think I know what Jack's trying to say there. There's something we see usually in smaller terrier breeds very often. They'll look like they'll be running along quite happily, and then they'll skip on their back legs. They'll skip a back leg for a little bit, and then they'll go back to normal running, and then they might skip the other one a little bit. Okay, and something's happening in their knee. And that thing is they've got a luxating patella. So that means their kneecap is slipping in and out of the channel it runs in. And ultimately that's what causes that skipping. So effectively they run, the patella luxates or slips out, and then the leg is stuck in extension, so straight, and they'll skip. And then ultimately it slips back in and they go back to running again. Very often it's non-painful, but still something we should deal with. So the dogs won't yelp or stop. They'll very often just keep running. And clinically, what we see is you can actually physically manipulate that patella out of its groove in a clinical exam. Again, it's not usually painful, and that's really because the trochlear groove that the patella runs in, the groove it sits in, is actually a little bit shallow in those dogs. And that's what a luxating patella is.